ILBS was set up by the government of Delhi, and it's an autonomous society under which the institute has come up with four major focus. One is of patient care, world class, teaching, which is degree courses and postdoctoral courses, training, that is skill impartment, and research. So we have our own PhD program, our own DM or MCH program regulated by MCI. And last year ILBS saw close to 97,000 patients with 26,000 daycare and about 7,000 liver emergencies over the years period. So the experience of ILBS as an experiment was conceived by Government of Delhi as a center of excellence. We got the recognition by the Government of India for MHRD, for deemed to be university. So we have our own students and we have our own method of teaching and training in hepatology, hepatopancreatobiliary surgery and liver transplant. We have a DM in pediatric hepatology and an MCH in HPB and liver transplant surgery. So I think it has been a very unique experience, and you are right in saying that ILBS possibly is the only dedicated liver university globally. We have about now 190 operational beds, but we hope to expand to 500 plus beds in the liver area. And also our very important sister branch is nephrology, which we are very fortunate. I think these are very rare groups. So the whole idea is a spoke and wheel. Center is liver, so a nephrologist has much more experience in liver and kidney. Cardiologist has more experience in liver and heart involvement. Pulmonologist has liver and lung as involvement, and oncologist has liver and cancer as an involvement. So this is a spoke and wheel with liver at the center, and I think this is the first experiment. Similarly for PhD programs, for regenerative medicine programs, liver and regeneration of liver is a major focus in the institute. Our faculty is young, vibrant, bright. Each one is smarter and better than me. They have their own ambitions, and I work as one of the faculty members there, have the opportunity of learning from them. Faculty includes hepatology as a dedicated branch where about 12 people are there, and the clinical nutrition related to liver as another branch. We have HPB surgery and liver transplant where there are transplant teams are there. We have pediatric hepatology. We have a liver transplant, anesthesia, critical care. So a total of about 60 odd very bright, the brightest of the bright are there in ILBS. We hope to start oncology in a big way, to have liver pancreatobiliary oncology as a big dimension. We see close to 500 cancers a year as it is, and we hope it will increase. We have a very unique system of GI bleed, like you have a heart command. So ILBS has a bleed unit which is 24/7. We see about 900 bleeders every year, and we have almost 40% of the beds are emergency beds. So our critical care is round the clock. We have our faculty trying and developing new protocols for managing and coordinating with each other. So I think it's a very unique experience and very friendly. But they work 6 days a week, not like all government hospitals, 5.5. So it's a corporate kind of a structure with 8 holidays only. They work and maybe 2 to 3 transplants a year. So it's a huge experience for students and faculty together. As far as liver disease burden, I think ILBS growth and recognition is itself a statement that the cause for which it was set up is genuine. That is, liver diseases per se is a very major burden. We don't have any data on how big is the problem, but let me put it in a simple manner, that if somebody has fatty liver, and 1 in 4 Indians have fatty liver, then you have an early diabetes, you have early heart failure, you have early blood pressure, you have more of development of kidney disease. So fatty liver is the first part of development of other systemic problems, even PCOD, even cancers. So if we can do the preventive part, I think India needs a huge satellites of ILBS like structures, and the burden of liver disease is huge. We need about alcoholic liver disease, for example, makes 45% of our hospital admissions. Young people, obese, diabetic, drinking heavily, have very few options to survive because they have been drinking. So I think India has liver disease probably amongst the major burdens. If you take off cancer-related deaths, liver cancer is the second common cause of cancer deaths globally, and in India it is third common cause of cancer deaths in the country. Similarly, cirrhosis, there are millions of people. Hepatitis B about 45 million, C about 10 million. So if you take the burden, 6% to 10% of population has viruses. Fatty liver, maybe 1 in 4 adults have fatty liver. So the burden is huge, and where we stand globally, India has an opportunity of understanding its own race, its own genes, and to have a niche in making new protocols. So the journey from ILBS is just the first step. I would like all over the country people to understand that liver is the second heart, is probably more important, and this organ is the one which drives what you eat. For example, we are currently having patients who alcoholic liver disease. They have no transplant option because they were drinking till yesterday. There is no donor. So we do fecal transplant. We put this stool of a healthy donor through the gastric route into the intestine. And this is the first way in the world to show that people with alcoholic liver disease can improve. So we have an FMT, fecal microbial transplant. We therefore have many new innovations. India stands on the crossroad of not only understanding the magnitude of the problem, but also through ILBS like structures, teach people, pollinate the ideas into many more physicians, youngsters, researchers, so that we can make a difference by having clearly defined goals. For example, regeneration of liver. We have shown globally that it is your bone marrow which makes new liver. So by stimulating bone marrow by some growth factors, you mobilize cells which go to liver, and liver can regenerate. So many patients, 1 in 100 probably gets a transplant. What happens to 99? To make them have small 5% new liver makes a difference. To regeneration of liver through new protocols, fecal transplantation, new drug opportunities. I think India has a huge role to play, and I encourage every young scientist, every young clinician to at least look at it from a perspective. It's in infancy. Hepatology compared to cardiology or maybe nephrology is in infancy, and therefore there is a scope, there is a space, and there is an opportunity to show your worth. And I encourage Indians to come forward, collaborate. Our university has about 17 international MOUs, from Albert Einstein to Korean or from German, and we have an exchange programs. We are the only university outside Europe for a Pasteur Institute to sign up. So we are a Pasteur Institute collaborator. We are a collaborator outside with INSERM. So the only other European place outside Europe is ILBS, where you have metabolomic, metagenomics. All these are areas which are evolving, and I think through ILBS I have been very lucky, and through the government of Delhi's support I have been very lucky that this institute has made some recognition not only in clinical teaching, patient care, but also original research.